Hello, my name is Jeffrey Knabe, and I am an orthopedic hand and upper extremity surgeon. I had an early interest in healthcare, starting down in elementary school. Learned more and more about it, found more about it in college. Then I went to med school because it made sense. I wanted to help people. Didn't know really how. That's why you go to med school, right? And I found out about orthopedics, and I'm kind of simple person, so I figured out that they put Humpty back together again. And that sounded awesome, so became an orthopedic surgeon. And then during that training, I found out about hand surgery, and that's why I went into hand surgery. I give people back their hands, you give them back their independence, you give them back their profession, you give them back their ability to care for others. I treat little babies all the way to geriatrics, all the way to the, beginning of life to end of life, so it's pretty inclusive. One of the more common things I treat is like carpal tunnel, hand arthritis, overuse injuries, and when you're treating these very common things, it's nice to have options for patients. So I can do carpal tunnel under just simple local or in the OR. I do it endoscopically with a small incision and camera or open. And so all of those have pros and cons, and that can all be part of a conversation I have with the patient. Other things I treat are arthritis. So there is a form of joint replacement for thumb arthritis, so a small joint replacement in the hands and the wrist, and that is also what I subspecialize in. So my goal is when I meet a patient is that I get to know them enough that I can understand what their needs are, and then I can tailor what I actually do to them so it makes sense in the context of their life. Maybe I'm fortunate that I went to med school and a residency program that really emphasized that. So, the first thing I want to do is make eye contact with the patient, touch them, shake their hand, and sit down and have a conversation. And then everything else branches off from that. Because if you don't know who the person is and what they're looking for, then it's impossible to treat them. Sometimes you're born with a hand that's not quite right, or it's a little different, a little special. You can give somebody the ability to hold things, to hold a pencil, to color. That's really cool. But then you have the guys who are actually the workers, the carpenters, the mechanics. They cut a tendon, they lose function. You put that tendon back together, now they can hold a wrench again. They can swing a hammer. That's what I love. You give people back their independence, their profession. I got 4 kids, so that is about all the interest I have right now. We do a lot with our kids, a lot of sports, a lot of activities. We live close to Lake Georgetown, so we do a little bit of hiking and biking out there.